after 8:30 this morning, and we've got the health department in with us this morning for their monthly meeting. That's right. You guys have a lot going on. We're gearing up for spring and summer.
We sure are. They've got a lot of plans going on. You know, the community-wide baby shower, the back-to-school bash is all being planned. They've got a grant for bike helmets, ATV helmets, so they're going to be having those programs again this year. So don't have the dates all set out quite yet, I don't think. So
it's just as we move into summer, it gets really busy really fast, right?
Mm-hmm.
We've got Alicia with us today, and you've just got a lot going on. You've
Yes.
been growing professionally quite a bit, so tell us about that.
Yeah, so I just got back from the Indiana Vector Control Conference, and I was elected president. So for 2028, I'll be president.
Yay!
Yes, I'm excited.
That's exciting.
Yeah, I'll be.
It's a big deal.
Yeah, I'll be putting together
It is.
the speakers and helping pick out the location for that year. So that'll be really awesome. I'm also on the Food Protection Committee for the Indiana Environmental Health Association, so I'm a co-chair for that. We get speakers for meetings throughout the year, focus on food safety, and we'll be working on getting a bunch of speakers for the fall conference this year in September. So
Well, that's
very
exciting.
exciting. Yes.
Yeah, congratulations.
Love it. Thank you.
You are working on the community garden. This is something that was started last year and was a great success, and
Yes.
so it's growing this year.
Mhm, absolutely. Yeah, we are in fact doubling the garden. So we had last year we did 1,000 pounds, around 1,000 pounds harvested. This year, obviously, we're hoping to at least double that. So we had 12 in-ground beds last year. We're going to do 24 this year. We have 9 raised beds. We got a bunch that we're going to just, they're donated to us. So we're getting about 12, I think, additional raised beds. We're going to have a lot of produce this year. I'm very excited. I have a whole list if you want to know what I've got.
Well, so last year was a zucchini that just was like a plethora of
Oh my gosh,
zucchini.
we had so much zucchini and cucumber. Everyone loved that too. So we're doubling those plots. We'll
Okay.
be doing twice as much zucchini, tomatoes, and cucumbers.
And squash, was that the one that
Yeah,
was...
we had the yellow or orange ugly squash.
It was
that
bumpy.
Some people didn't know what to do with.
Yes. It was the
But you really
squash.
can cook that. So.
Yes.
So what are some of the other things you're going to have in the garden this year?
We're going to have green beans, bell peppers, jalapenos. We've talked about adding asparagus and garlic into the garden. I think garlic is something that we'll have to plant later in the year, I think.
Yeah, I
but
think so.
yeah,
I've never tried that.
we'll have it. We'll have potatoes, russet and sweet, onions, lettuce, radish, basil, sage, rosemary, carrots, and strawberries.
Oh, fun.
Very excited about that.
Do you have a strawberry patch yet, or is that a new
No,
addition?
it's going to be new.
Okay.
Yep.
Well, that's exciting.
Yes.
But with all of those things
Mhm.
comes the need for...
Volunteers, yes. This is my plea to you, anyone listening. We are going to need all the help we can get this year. Fortunately, we're going to put down tarps again to kind of cover the weeds and kill that top layer of grass, but we're just going to leave the tarp down this year. So we'll have less to worry about regarding weeds, but we still need help with watering and harvesting and just maintaining the garden. So once we get everything going, probably mid-May, starting in June probably, we'll start harvesting our fruit and vegetables, and we're just going to need as much help as we can get. So everything is going to be at the Health Department, 315 South Ireland Street. We're right near the little park over there, but you can come in any time really to volunteer, to pull weeds, to water. But at the moment, the tool shed, you need access to that. You can only come to the Health Department to get the key for that. So Monday through Friday, 8 to 3, we recommend you come in anytime between then to get the key for that.
It was so hot last summer. I
Yes.
want to say that a lot of times I didn't come during those times, and you can just bring your own tools.
Yeah.
You know, bring
Yep.
your own gloves, bring your own tools.
Absolutely.
You know, you
It
don't
doesn't
need
take
that
much to weed.
It
You
does.
just
Yeah, you don't
take
need that
those
much.
hands and go.
Yep.
And just coming by even for 30 minutes is benefit if we can get more
Yes.
people out there to help. And it really, it's good for us all to be outside getting some vitamin D. I mean, we gave away this food. You know, it's out there for people that want it. It's also out there for the volunteers. You know, they can take some home. It's to try to help nutrition in our community is our big aim.
So let's talk about it a little bit for those that maybe didn't know about it last year. It's community garden, but that's what its intention is for, is to go back into the community.
Yes.
Absolutely. So our intern in 2025, Esther Parr, she's actually now working on her PhD in Missouri. So we miss her, but she started the idea. And one of the reasons that we had done this was because we found that there was a lack of access to fresh food, and we wanted to fix that. So the community garden was created.
And someone that lives in an apartment or in town that just doesn't have the space, this is an access point.
Absolutely, yeah.
And it's an opportunity for them to come out and do some gardening. You know, if they don't have the resources, the area to do that, they can come out and enjoy it. So, because I love to garden. So.
And also having the raised bed. So it's really pretty accessible to anyone with a raised bed. So talk about what those look like and how that works.
So we have 5 handicap accessible raised beds on top of our pavement. So anyone who's maybe in a wheelchair or with a walker, we still have, there's still an area for you to work in if you want to get your hands dirty. You can just walk right up to the bed, and it probably comes up to your chest maybe, and you can just stand there and kind of work.
It's reachable from all sides, so people can do that even if they have back problems. So
It's inclusive for everyone to be able to come and participate. Right now, is there any work that needs done as far as preparing?
Monday.
Next Monday. Next
Speaking
Monday
of.
at 11 o'clock, we are going to be doing our tarping day. We'll provide lunch for anyone who wants to come, but we're going to put down tarp on the current beds that we have, and then we'll tarp the new area as well. So that's just going to kill that top layer of grass, like I said, kill the weeds. It's going to just prepare the soil to plant into.
All right. And you guys partner, it's at the Department of Health, but you also partner with some other community people.
We work with the Decatur County Recycling, Decatur County Purdue Extension, our Soil and Water Conservation District, and the library.
Oh, it's a group effort
Yes,
to get
absolutely.
the community garden up and going. And so after, how long does the tarp stay down? Do we have a time frame?
So
Well, it's going to stay.
it's gonna
before
stay,
you
yeah.
plant.
Yeah, it'll stay down all year. For us this year, it'll be easier, like I said, with the weed control. But last year, I think we did 6 weeks-ish.
Okay.
Yeah,
So
but
planting will come later. This is
Planting will
tarping on
come later.
Monday.
Yes, tarping on Monday. We're planning after Mother's Day. We don't have a date set, but I think it's the weekend after Mother's Day that we're planning on doing our planting day. So,
Right. Yeah. Very good. That's exciting
Yes.
news.
And I think you're going to do the wildflower garden again.
Wildflower
out there
garden.
It attracts pollinators, but also is a great photo opportunity.
yes, a lot of
That is really
photographers
pretty.
took advantage of that
It was
last year.
beautiful
Very
last
pretty.
year.
And we're expanding that as well. So it's going to go out a little bit farther too this year. So twice the opportunity for pictures, I guess, and pollinators.
That's right.
Yeah.
It's perfect. And of course, all of the produce that's going to
Yes,
come out. So,
absolutely.
very good. What else is happening in your world at the health department?
In my world, so I thought it would be an opportunity to talk about ticks.
I just this morning heard that they expect them to be worse this year.
Oh, really?
Yes.
I have
Ticks
not been told that, but
Ticks and bugs. It was on the Today Show.
oh, okay.
And they said that they're already emerging, and so they feel like it's going to be a bad year.
Could be.
So we're going to keep you busy this
yes,
year.
which is fine. I have really enjoyed the
It's not
bugs.
fine, but you enjoy it. That's okay.
Yeah, maybe I should correct that.
Change
So, ticks will start to come out once we're above freezing. They prefer anything, I think, around 40 degrees or higher, so you might already start to see them. So, working in the gardens, just keep that in mind. They're most active from April to June, and then late summer, early fall. They don't like midsummer because it's too dry. They like to stay moist, so they'll dry out in the summer, but we'll see them in the spring and into the fall. They like tall grass, brushy, wooded areas, and some ways that you can reduce your tick bites is to just reduce your exposure to ticks. So I always suggest wearing light-colored clothing if you're going to go outside, so that way if you're doing a tick check when you get back home, you can see if there's a tick on your body. Reduce the amount of skin that is exposed. I know it's going to be hot in the summer, but wearing long sleeves is recommended. If there's nothing for them to crawl onto and latch onto, they're just going to fall right off.
Okay.
So wear long sleeves, tuck your pants into your socks or your boots. And the last thing that we'll recommend is to wear an EPA registered repellent. So anything with DEET, picaridin, IR3535, oil of lemon eucalyptus, those can all be found in your big box stores. So easy to just spray on your clothes and go out.
And repel them. Keep them
Repel
away.
them. Keep them away, yes.
We've got Dr. McCullough with us too. So if in the event the tick bite does happen, what do we do from that point?
Well, some of it is all about how long that tick is on. So the key is get it off as soon as you realize you have one on. And you do need to be careful. You can't just rip it off and leave the head in there. You really need to get the whole tick off. And there's things that you can buy. I bought a couple because we camp a fair amount and are out in the woods in Brown County that help you really get under that tick and get it off. You can also use tweezers, but you just have to do it carefully. But I'd say get it off as fast as you can, reasonably. On the other hand, it doesn't need to be that second. And then the other thing is just if you find you have a tick on and you really don't know how long it's been there, you probably should contact your provider for their recommendations. So
Lyme disease
also take that off.
Take that off, yes.
But if it's like some places like, oh my gosh, I wonder how long that's been there, then you need to be talking to your provider.
There's a chance of Lyme disease with ticks, so we want to make sure we keep everybody good and healthy.
Yes, and we do see Lyme disease in Indiana. We I know in the office we would have people every year, that we would see with Lyme disease. So
it does exist. And
I don't remember the incidents.
It is throughout the state, unfortunately. I do want to bring up the Indiana Department of Health tick dashboard. It's something that they're very proud that they've worked on. It's very interactive. I love it, and I'm going to push that out there for them. So on the off chance that Lee Green is listening, here you go. So if you go to any search engine, just type in IDOH tick dashboard, and that's going to bring up the Indiana Department of Health website, and it's going to have information about tick-borne diseases, tick prevention, and then there's a map as well where you can kind of check out different counties in the state. Click on the county, it'll tell you what ticks are prevalent in the county, and then the associated diseases.
Wow.
Yeah, it's pretty awesome. I love it.
Well, just the accessibility so that if you're traveling somewhere, you're going camping somewhere, you at least know what to be aware of.
Exactly.
Very good. Well, we hope to keep you busy with tick season, but not overly busy, right?
Yes.
Now, is there, if you do, you pull a tick off of yourself or someone that, are people still sending those ticks off to be tested, or is that no longer?
So we've been told by IDOH that they don't often do tick testing. So if you find a tick, let's say I go outside, and a half hour later I come inside and I find a tick on my body, and I'm all of a sudden worried about Lyme disease. I send it off to the lab to get it tested, and it comes back positive for Lyme disease. That's going to just initially freak me out. But no worries, because ticks, I think it's like 48 hours they have to be on you before they can really transmit anything. So if we send a tick in for testing, it comes back positive, we're just going to scare you for no reason, really.
Because it's positive does not mean you necessarily contracted it from
Correct.
the tick.
Right. Mm-hmm.
Yeah. Very good. Well, happy tick season, right?
Yes.
Here we are. And once again, Monday is TARP Day, so tell
Mondays.
us those details again.
Yes, Monday, the 23rd at 11 o'clock. Just meet at the health department. Bring something warm, because I think it's only going to be like 50 degrees. Hopefully.
Which is better than today.
Better than today, yes. I'm just hoping for no rain. If it rains, we'll have to reschedule, but
hopefully not.
Fingers
Ready to get
crossed.
the garden going, right?
Yes, I'm excited.
Very good. Dr. McCall, we've got you in as well. You've got your Walk with the Dog shirt on, so let's talk about that.
So, well, the reason I wore this is because this is my blue shirt. I did want to talk about, this is National Colorectal Cancer Awareness Month, and the color is blue. So this is the only blue shirt I have. But Walk with the Doc does have some to do with that, because exercise does help prevent colon cancer, actually. So I really wanted to kind of get some statistics out there, because I think that kind of brings it home to me when I hear numbers. It is the second leading cause of cancer death in the United States now, is colon cancer.
Really? I did not know that.
We hear about, and it's scary about breast cancer, but it's actually colon cancer is the second cause of cancer deaths. Lung is number one, related to cigarette smoking or secondhand exposure, unfortunately, but it's actually colon cancer. In 2025, there were 154,270 new diagnoses. 52,900 people died of it. In 2026, they are predicting 158,850 new cases. So it's going up still. 55,230 will die of that. And this is estimated, obviously, by the American Cancer Society. Indiana, if we break it down more to our area, new cases will be 3,510, and deaths will be 1,260, and that's predicted for 2026.
So almost a 50% death rate off of the new diagnosis.
Well, it's yes and no, because these are new cases. So that includes anybody at, they could be diagnosed at stage 1 or at stage 4. So this is rolling everybody in together. If you actually look at numbers, the 5-year survival rate for cancer, if it's caught when it's localized in the colon or the rectum, is 91.5%. So we have made huge strides in that, but the key is, it's got to be localized, or hopefully even prevented. Once it's spread beyond the local area or metastasizes, is the word, it goes down to 65%. So it's still better than you might think.
It's a very treatable disease.
Yes, it is,
at the right time.
if caught at the right time. The median age for diagnosis in the United States is 66. But early onset colon cancer, and this is anybody termed less than age 50, that has increased by 131% since 1994. Now
wow.
that is a scary number.
That is
131% increase since '94. So they're trying to figure out why. Why is that the case? Because it is really a preventable disease. Colon cancer starts as a small little polyp that grows up through the wall of the colon, and if that polyp is just removed before it's even turned cancerous, you didn't even have cancer. Or if it's just early turned cancer, it's very easy to resect just that polyp. So what they're finding, though, is that there are certain risk factors, and unfortunately we in Indiana are not real great on these. It's more common in men, so men out there need to know that. Unhealthy diets contribute, and we in Midwest are not the best at that. Really, we shouldn't have more than 3 servings of red meat in a week's time. We should be avoiding processed foods, which is hot dogs, bacon, sausage, and bologna, all our favorites. We need more fruits, vegetables, nuts, whole grains. We all hear about the nutrition, but it does definitely have to do with that. Obesity has to do with cancer risk, particularly colon cancer risk. 69% of Americans 18 and over are overweight or obese. But in Indiana, we take a blue ribbon here. We're 72%. Wow. So 72% of Americans 18 or over are overweight or obese in Indiana. And then here's the scary part and why we think maybe things are increasing in that younger age group. 17% of high school students in Indiana are obese. And that's in Indiana. In the U.S., it's 16%. So again, we kind of won the prize there. There's concern certainly about chemicals in our environment. Alcohol consumption can contribute, and there were statistics that alcohol consumption in the United States in the high school age is 21%. In Indiana, it's 25%. Sedentary behavior, 21% of adults 18 and over in the U.S. are not active at all. We're 24% in Indiana, so we keep getting these high points for things that we don't want. But then if you look at that sedentary behavior, and that just means no exercise, 13% of kids in high school don't get any form of exercise. I don't know what happened to gym and sports, I guess. I know they're still there, but apparently a lot of them are not doing that. Tobacco smoking, overage Indiana in the United States, statistics are at 12%. Indiana is at 14%. In high school, in the United States as a whole, smoking is at 4%. In Indiana, it's at 6%. So we keep coming up.
We've got to quit winning these.
Yeah, these are not things we want to win. The HPV vaccination rate, the HPV virus actually does help prevent colon cancer, in more the rectal cancer. The rate is 66% of eligible people have had that HPV vaccine. We're at 57 in Indiana. That's improved from the past, but we've got a ways to go. One of the biggest things that people need to know is family history. If you have a first-degree relative, so that's going to be a parent, a sibling, a child, if they have had colon cancer, that doubles or triples your risk. Like my dad had colon cancer, his dad had colon cancer. I will have colon cancer is fairly likely. I mean, my risk is 10 to 20% in my lifetime. But the baseline risk, if you don't have a family history, is actually between 5 and 6.
Really?
So that's, people buy lottery tickets for that
Exactly.
number.
So genetically, it's very strong.
Yes, it is. So, and there are some familial types of, but I don't have that kind, but I just have that family history. So my risk, if you have a familial type, your risk is much, much higher, and hopefully you've already been told that. But those of us that have any family history, we need to really be on our screenings. We get more frequent screenings, and it is all about screenings. If you catch it before it is cancer, that's the key. It's and like I said, that rate of cancer in people less than age 50 is just skyrocketing. So the recommendation now for screening is starting at age 45, and it goes till 75 to 80 depending on someone's health. I mean, certainly if they're in poor health, you would not necessarily be pursuing that. But for most people, it's not that hard to get screened, and they really need to do it. So, and it's been a recommendation since, I think it was 2019 by the American Cancer Society, but since 2021, pretty much every organization, including the United States Preventative Services Task Force, and that's what all providers really kind of use as recommendations, have recommended that. So, and as a result, insurance covers that. So. And it is covered under wellness. People's wellness policy would cover their screening. Statistics show that only 37% of people in that 45 to 49 year age range are up to date with any form of screening, though. So, so again, insurance covers it. They need to get it done. So
when we talk about screening, let's talk. Colonoscopy obviously is one. There's also been a lot of conversation about something called Cologuard.
yes.
So are any statistics that you have on that?
I didn't think to look up the sensitivity, but they're actually fairly equivalent. And there are a range of things people can do. It's really fairly easy. The probably the very baseline that's been done in the past and still available is what's called a fecal occult blood test. That can be done in office as a rectal exam, or you can do it at home. There's kits you can do it at home, and that you have to do every year, though, to be effective. Rectal bleeding is actually the top indication of colon cancer in someone less than age 50. So don't just write it off as hemorrhoids. You need to get checked. So that is one method. That one's not terribly sensitive, and I'm sorry I didn't look up the statistics. The next one that and I recommended this for a lot of people, is that Cologuard.
Yes.
This one it's totally at home. It's covered by insurance. People get this little box in the mail, and it's not written all over there that you're going to put stool in this box. It's very discreet. It comes with a kit that fits on the commode. You have a bowel movement into this container. You pour this little container of liquid on it and put the lid back on, put it back in the box, and then you can actually put it out in front of your house after you've arranged pickup, or you can take it out to go in postal, and it's the box again. It's very discreet, and you just drop it off, and it's done. If that comes back positive, that's checking for DNA changes in the stool sample that indicate colon cancer or precancerous lesions. Then you get the colonoscope. So the vast majority of people get a Cologuard, and they're done. That one is every 3 years, so that have to be kind of tracked and kept on a timeline. The colonoscopy, to me, that's the gold standard, and if someone will do a colonoscopy, that's really, to me, the best, but the Cologuard is now a way we can maybe start identifying and not scoping everybody, but just trying to identify who needs it. With that, you do need to take a prep starting the day before. With the other ones, there is no prep, actually, so that's the other advantage, meaning you don't change your diet, you don't have to clean out your colon, you just get those samples. The colonoscopy needs to be arranged ahead of time. You take the prep, you go to the hospital or surgery center, wherever you're going to have it done. They give you some sedation. And I mean, I don't remember mine other than I'm just talking to the nurse, and then I wake up after I'm done. During that, they slip a flexible tube through the rectum and up all through the entire colon. While they're there, they remove any polyps that they see, or they biopsy any worrisome areas. So sometimes they've removed the polyp. If they find out later it was a worrisome type of polyp, it's already out. So it's a way to treat also. That again, all those are covered under your wellness insurance, if you have insurance. There are 2 more tests that I'd mention. There's something called a CT colonoscopy. I'm not sure on insurance coverage because it wasn't real great for a while. I would point out, too, that you wind up taking the prep, which to me, the prep is the worst part. The procedure itself, no big deal. But you have to do the prep, then they do it, and if they find a polyp, then you have to go through the prep again for a colonoscope, I would point out. But maybe, again, a lot of people wouldn't have to do that, I would think. There is a blood test that you can do, and the one that I read about is called SHIELD. The bad thing is it does not detect precancerous or stage 1 very reliably, but it does detect 2, 3, 4 is probably definitely a no-brainer. It's going to show that. But weirdly, the studies that people that did that test, even though they had a positive test, I think it was more than 50% never went and got a scope done. So I don't know whatever happened to them, but I think that's kind of last-ditch effort to get somebody screened, and then they still didn't want to do anything. So in Indiana, 71% of people in Indiana are up to date with their screenings, which I was impressed.
Awesome. Yeah.
I thought that was really good. But this one, and I don't know where the study came from, but they said that 1/4 of the people overdue for their screening, only 1/4 of people were reminded by their provider to go get it. Now, I don't, maybe they were taking all visits. If somebody came in and they had an earache, I'm not probably going to tell them about their colon cancer screening. It'd be great if I had that time.
Sure.
But people, providers can't do everything in a 10-minute visit. But my message would be then people need to advocate for themselves, or their family. People, each person needs screened. Get your family screened. Make sure your kids. My oldest daughter turned 45. She's got hers planned, but make sure they know the risks. Find out your family history. Most of us share our family history changes. We probably should send that out with our Christmas cards, say Merry Christmas, by the way.
Right. Yeah.
Now I have diabetes and head polyps, just to
just
let
so everyone
people
knows.
know. All of us could do better on our diet. All of us need that exercise. 150 minutes of moderate exercise per week is the minimum, actually. So that's why got our Walk with the Doc group. Stop smoking, cut down on alcohol, and just be aware. So.
Very good. Great statistics, great information. And you just reach out to your provider if you know that that's something you need to do.
Yeah, if you're not sure when you got screened last, because I'm on the every 5-year plan, and because of my family history, and time gets away from me, so it just does. The Cologuard's even a little harder because it's every 3, so it's going to be more frequent. But I think that is a great option for people. So.
Very good. Thanks so much for sharing all of that stuff. Again, it is Colorectal Cancer Awareness Month, and wear your blue, right?
Yes, that's right.
And have it out there. Community Garden, once again, coming up Monday. They're going to tarp.
Yes, Monday at 11 o'clock.
All right. All kinds of good information. We look forward to next month and seeing what we'll talk about then, right?
Yeah, okay.
All right. It's 9:01 here on Tree Country, 1330 WTRE.